Hello everyone. Today we're talking about something that's often whispered about but rarely discussed openly, erectile dysfunction or ED. It's more common than you might think, and it's nothing to be ashamed of. Let's break down the stigma and get you the information you need. So, what exactly is erectile dysfunction? In simple terms, it's the inability to get or maintain an erection firm enough for sexual activity. This can happen occasionally, and that's usually not a cause for concern. But if it's a recurring problem, it's important to talk to your doctor. Remember, you're not alone in this. Millions of men experience ED, and the good news is that there are many effective treatments available. We'll dive into those in a bit. First, let's understand the signs and symptoms of ED so you can recognize if it's something you might be dealing with. It's important to remember that experiencing erectile dysfunction occasionally doesn't necessarily mean you have a serious problem. We all have off days, right? However, if you notice a pattern of these symptoms, it's time to have a conversation with your doctor. Difficulty achieving an erection. This is often one of the first signs of ED. You might find it hard to get an erection at all, or it might take longer than usual. Difficulty maintaining an erection. You might be able to get an erection, but you can't keep it firm enough for intercourse. Reduced sexual desire. This can manifest as a lack of interest in sex or difficulty getting in the mood. It's crucial to understand that these symptoms can also be indicators of other underlying health conditions like heart disease, diabetes, or high blood pressure. So seeing your doctor is essential for a proper diagnosis and to rule out any other potential issues. Now that we've covered the signs and symptoms, let's delve into what causes erectile dysfunction. Many factors can contribute to ED, and often it's a combination of things. Physical causes. These include conditions like heart disease, diabetes, obesity, high blood pressure, high cholesterol, and hormonal imbalances. Certain medications and treatments for prostate cancer can also lead to ED. Psychological causes. Stress, anxiety, depression, relationship problems, and performance anxiety can all play a role in erectile dysfunction. Our minds and bodies are deeply connected, and emotional well-being is crucial for sexual health. Lifestyle factors, smoking, excessive alcohol consumption, drug use, and lack of exercise can also increase your risk of developing ED. These habits can damage blood vessels and nerves, affecting blood flow to the penis. It's important to remember that ED is often treatable regardless of the cause, once you and your doctor determine the underlying factors. You can explore the best course of treatment for your individual needs. While we'll discuss specific medical treatments in a moment, it's important to remember that sometimes the simplest solutions can make a big difference. Making positive lifestyle changes can significantly improve your sexual health and overall well-being. Quit smoking. We all know smoking is bad for us, but did you know it damages blood vessels and affects blood flow, including to the penis? Kicking the habit is one of the best things you can do for your heart, lungs, and yes, your sex life. Limit alcohol consumption. While a glass of wine with dinner is fine, excessive alcohol intake can contribute to erectile dysfunction. Alcohol can interfere with erections and, over time, damage nerves and blood vessels. Maintain a healthy weight. Obesity is a major risk factor for erectile dysfunction. Losing even a small amount of weight can improve erectile function and boost your overall health. Exercise regularly. Physical activity is crucial for maintaining good cardiovascular health, which is essential for healthy erections. Aim for at least 30 minutes of moderate intensity exercise most days of the week. These lifestyle modifications may seem simple, but they can have a powerful impact on your sexual health and your overall quality of life. The good news is that there are many effective treatment options available for erectile dysfunction. The best approach for you will depend on the underlying cause of your ED, your medical history, and your personal preferences. Medications. Oral medications like sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra, are often the first line of treatment for ED. These medications work by increasing blood flow to the penis, helping you achieve and maintain an erection. Vacuum erection devices. This involves placing a tube over the penis and creating a vacuum to draw blood into the penis, resulting in an erection. Penile injections. This involves injecting medication directly into the penis to relax the muscles and increase blood flow. Penile implants. In some cases, surgically implanted devices can be used to achieve an erection. Psychological counseling. If stress, anxiety, or other psychological factors contribute to your ED, therapy can be incredibly beneficial. Remember, it's essential to consult with your doctor to determine the most appropriate treatment plan for you.